Good afternoon. I'd like to say hi to you all. I apologize for not being able to stand in front of you today. A snorkeling trip to the Hawaiian Islands had been on my calendar for months, but I could not pass on the opportunity to speak to all of you. Please do not mind the beautiful sands and sea that occupy my background. Again, thank you for inviting me to the scientific meeting of the Circumpolar Health Research Network. This network is very important to me. Life in the circumpolar north, as we all know, is changing. People are becoming more mobile, and access to the rest of the world is at our fingertips. The health of Arctic populations is of utmost importance. As we think about what challenges this next decade will bring before us, there are 3 strategies that we should consider to improve the health of Arctic populations. Number 1 is access. Access to healthcare is pivotal to improve long-term health outcomes. When we think about the word access, what terms come to your mind? A quick Google search will bring up tons of options. In the circumpolar north, access to care often is perceived as a disadvantage because access tends to present a range of barriers, including the high cost of healthcare, experiences of discrimination and racism, and poor communication with healthcare professionals. Disparities in care tend to exist between indigenous and non-indigenous populations. Thinking about pregnant women specifically, for example, Odlin and Arbor confirm that while 80% of pregnant women in Alaska begin their prenatal care in the first trimester, only 70% of Alaska Native women do the same. Number 2 is infrastructure. In 2014, a state analysis was released that examined the healthcare services available throughout Alaska. The report, which was commissioned by then Governor Sean Parnell, analyzed areas of the state that lack coverage and where state and federal money goes in providing health care to impoverished Alaskans. According to an article in the Alaska Dispatch News, which was written by Laurel Andrews in 2016, this report, commissioned by Governor Parnell, indicated that specialty care is hard to come by on a statewide level. The report concluded that gaps in inpatient and specialty care, including imaging, technology, radiation, and chemotherapy, oncology, and certain prescription drugs, are perhaps the most challenging areas to address. The widest array of specialty care is available in Anchorage and to a lesser degree in Fairbanks. Number 3, sustainability. Populations in the circumpolar north have seen many of their traditions stripped away from them, not by chance, but because their values were perceived as inadequate. Indigenous populations were absorbed into Western models of medicine and healing. Traditional healers and practices became almost non-existent. Western medical doctors were placed in villages and communities where the culture was not understood. Physicians came and physicians went, month by month and year after year. There became a disconnect between physician and patient. Physicians became an unreliable resource in many villages. It is important that government officials, funders, researchers, public health professionals, educational institutions, and other areas of expertise focus on implementing strategies that not only create improved healthcare systems, but also improve the environment or the perception of healthcare. I think access to healthcare, infrastructure, and sustainability can be improved using 3 basic principles. According to Revel, Morrison, Griffin, Chapman, and Woods in 2014, evidence suggests that access to healthcare in the circumpolar north can be improved when services are tailored to the needs of, or owned and managed by indigenous populations themselves. This is likely because localized healthcare services are more likely to be free from assumption, racism, and discrimination, and are more culturally appropriate than services available in more urban cities. Local healthcare centers also tend to employ local health aides who are able to speak the local language and are known by people accessing the services. Progress in infrastructure can be improved utilizing new technologies. While it is not fiscally feasible to employ specialty physicians in each village, in each community, or even in each region, using telemedicine technology can alleviate pressures to travel long distances for advanced screening, imaging, follow-up care, and consultation. A 2012 report by the Institute of Medicine for the National Academies, which was entitled The Role of Telehealth in an Evolving Healthcare Environment, found that telehealth drives volume, increases quality of care, and reduces costs by reducing readmissions and unnecessary emergency department visits for rural communities. Through telemedicine, rural hospitals can serve rural patients at better costs and help cut down on the time it takes rural patients to receive care, particularly specialty care. Sustainability of all practices is something that must be addressed. Instilling community members in conversations about healthcare needs can transform outcomes. Funding programs that have proven successful should be continued. For example, the Community Health Aid Program, which is based in rural Alaska, uses a non-traditional type of provider, the CHA, to provide basic care to village residents. CHA training is provided in a 20-week course and includes both classroom and practical education and training. Regional tribal health physicians and dentists are used by the CHA for consultation and referral. This model has been expanded to include behavioral health aides, dental health aides, to provide comprehensive care to Alaska Native people. According to Bjerregaard, Young, and Berner, approximately 60% of the Alaska Native population lives in villages served by the Community Health Aid Program and those clinics, and the remote care has been a major contribution to the improved health of the population. It is exciting to me to think about the potentials in healthcare in the circumpolar north over the next 10 years. I envision a population that is on the cusp of thriving, a population that sees potential in their own health. I hope you'll join me in this vision and pursuing a challenge that will inevitably change the health of the world for the better. Again, I thank you for having me, and I'm going to go out and start my adventures in Hawaii. Take care, everyone.